your bladder is supposed to be 2/3 full before your brain will register that it's full and you need to go to the bathroom. So if you are going every 2 to 3 hours, then your bladder is not filling up to that 2/3 full. So how long it typically takes is 3 to 4 hours for your bladder to fill to that 2/3 mark. The problem is that it's a feedback loop. So if you're going every hour, your brain starts to register that your bladder is full when it's really only 1/3 full. So if you come into that routine, then your brain will start to register that your bladder's full when it's really not. And then you're going to have to go to the bathroom more often.
I'm your host, Kim Hines, and welcome to the Emotional Eats podcast. I'm on a mission to show you that what you consume, not just the food, affects your entire life. Midlife is different. Let's dig into the real reasons why you eat when you're not hungry and why you're not feeling well. My guest and I are going to give you doable solutions and help you let go of perfectionism, food rules, and stress to make changes that will last a lifetime. If you're ready to ditch old school diet culture and nourish your entire life, this is the show for you. Welcome to episode 59 of the Emotional Eats podcast. In this episode, which is highly requested, I invited my own expert, my own physical therapist, Sarah Sudheimer, to come on the show and talk about pelvic health issues faced by women in midlife. It's hard enough to talk about menopause symptoms that are very embarrassing, but then when we get into the pelvic floor area, it's even more embarrassing. And Sarah makes it so easy to talk about, but also gives us a lot of hope and a lot of tips. And I even share my own personal and vulnerable story of working with Sarah because I want you to know that you are not alone if you're dealing with some of these embarrassing issues like painful sex, vaginal dryness, urinary incontinence, or any other pelvic health issues like prolapse. Sarah does an amazing job of explaining everything, but also giving us some really doable and practical tips to get started. Reach out to Sarah, click on the show notes, and all of her links are in there. And we look forward to hearing your questions. If you have any other questions that you would like to ask, let us know. We'd love to hear. Give us a 5-star rating and review, and enjoy the show. Hey, Sarah, welcome to the Emotional Eats podcast.
Hi, Kim. Thanks for having me.
I'm so glad to have you here. And for the listeners, you'll get a little bit more of our story, but Sarah is not only someone I've worked with professionally, but she's also a really good friend of mine. And the topic of pelvic health has come up, and I really wanted to share more information with all of the ladies out there going through perimenopause and menopause, because we often think that pelvic health, we only have to deal with it if we've had children, but it's so much more than that. And so I invited Sarah on. Yes. And just to give everybody, I'll give you more insight into this, but Sarah was actually my physical therapist. And so Sarah, what I would love for you to do is just share, where did your passion come from for physical therapy, and kind of take us through, like, how did you get to where you are today, where I met you?
Yeah, so it's kind of funny. I originally got into just physical therapy. I always knew I wanted to be in the medical field. And in high school, I took a course that kind of dove into all of the health professions. And I ran across physical therapy. And the biggest thing that kind of made me want to head in this direction was the fact that I didn't have to see patients once every 3 to 6 months. I got to see them on a weekly basis and get to develop a relationship with them. And I think that's so special to have that as a medical provider. I think I get to know my patients a little bit more and also get to hear symptoms that they may not have thought about in that 15-minute visit with their doctor. So it's a great field to be in, and I love it. So.
Oh, I love that. Go ahead.
So, but then I started specializing in pelvic health about a year after I graduated PT school. Um, the when I was in PT school, we took one course, and it's not a course, it was a lecture. It was a 3-hour lecture on the pelvic floor. And I remember hearing it, and I was thinking to myself, this is something that I think is more important than a 3-hour lecture. And I also looked around at all my classmates, and all of them were very uncomfortable with the topic, and all of them were kind of being immature about it. And I was like, I'm not uncomfortable with this at all. Like, I actually feel like this is my thing. And so I decided to take a course on pelvic health when I graduated, and I've taken several courses because it's very there's different realms that you can go into with it, like women's health, men's health. You can focus on areas such as pregnancy and postpartum, menopause, and even elderly care. So it's a cool field to be involved in, and it's up and coming. So
Yeah,
lots more research to be done.
we're seeing it come up more and more. And I think part of that is breaking down that stigma and being able to talk about it. And people like
Mm-hmm.
you, PTs like you, are actually helping people feel more comfortable talking about it. And like
Yeah.
you said, you draw symptoms out of people because I'm going to tell the listener a little personal story that how Sarah and I really got together. I went to Sarah the very first time I had an injury, and Sarah, you'll have to remind me how to say it. It was the patella tendon issue, the femoral pain syndrome or something.
Patellofemoral disorder. Yeah.
Yes, I never say that correctly, so I knew you'd pick it up for me. Pick up the slack for me. So that was the first time, and then the second time, um, we were getting to know each other, and I was so comfortable because Sarah made everything seem so normal. Like, hey, we're just going to do this. The other thing I loved about you is you were not telling me, oh, that hurts when you run, don't do it. You were basically saying, we're going to get you running again. In fact, I remember you running behind me in the parking lot to double check how my hips were. And I had the hip drop
I
going
remember
on.
that.
And
Yep.
I had that for years. So that was so cool. You are so good at what you do. And then the next time I was with you was the piriformis situation. And that's what
Mhm.
really pivoted into what we're talking about today because Sarah was working on my piriformis externally and giving me exercises, and we were building up, I believe, the glute med was what we were working
Mhm.
on. And then you also
Mhm.
did some massage and things like that. And I don't know how we got to this conversation, but again, we're getting closer and closer, getting to know each other more, getting to know about our families. And she's like, hey, I think I can release that trigger from the inside. And I was like, I think I know where she's going with this. And I'm like, the inside. So obviously, for anybody who's not cluing in, that was vaginally. And I was like, okay, well, I'm going to get to know this girl even more. And but I was so desperate to have that situation taken care of that I went ahead and said, yeah, let's do it. And I trusted Sarah so much that I just was like, I've gotta try it. And I know you are so professional. And it was funny because you are clinical so that you are very professional, but you are also very empathetic to going through like kind of an embarrassing situation. And but that is when we talked about doing pelvic floor work. And we realized that
Yes.
I wasn't exactly as strong as I could be. And that was about the time I didn't realize it, but I was probably in perimenopause at that time. Things were kind of
Yeah.
starting to fall apart. Incontinence was kind of starting to be a thing when I was running. I was noticing I wasn't able to, I'd have to go to the bathroom right before I went running, or if I was jump roping. And so Sarah took me through some sessions, and we actually were able to, she was able to teach me how to work on my pelvic floor and really strengthen it. And I still do those exercises. I don't know how many years ago do you think that was?
Gosh, I think it was like four years ago,
Yeah,
something like
probably like
that.
4 years ago, and I would go back
Yeah.
to you in a heartbeat. But let's talk about this because now that I've shared that story, I'm hoping that women out there are realizing, hey, this is not like I felt like I was a kind of a healthy person. It's not about health. It's just about things that happen. So what are you seeing in midlife women? Women over 40, they're in their 40s, 50s, 60s. What's happening with the pelvic floor?
Yeah,
And where
so
is the pelvic floor? Maybe we should explain that too.
maybe I should get my pelvic model.
Oh my gosh, I love that.
Yeah. Actually, I'm gonna go grab it. Hold on one
Go grab
second.
it.
Okay.
And for those
So
listeners who can't
first,
see this, just know that we'll put video clips out online for this.
so first, the first complaint that I hear a lot about is vaginal dryness. So that is something that I can look at the tissues externally on your vulva to see if you have. A lot of symptoms that are reported with that is irritation with just walking because their tissues are not lubricated and it's causing some chafing. And then also pain during sex, specifically at the insertion of the penis. So um, it tends to get a little bit drier on the outside. And so a lubrication is a great way to fix that. Everybody, so each person has a different preference on the type of lubrication that they use. I personally like just coconut oil, something natural. Olive oil works as well. But you have to be aware that it does eat away at latex. So if you're using a condom for protection, it can degrade the latex in that. So, but one of the tips that I recommend is to just use a little dab of olive oil daily to coat your vulvar tissues to just decrease that chafing. And then also there's the choice of vaginal estrogen, which is a local hormone replacement therapy. It doesn't treat any other symptoms with perimenopause or menopause, but it will help with the vaginal dryness that you're experiencing because of the menopause. Um, the other things or the other symptoms that kind of come along and I hear people talk about is well, I'll talk about some of the symptoms that accompany this. So when we go through perimenopause and menopause, we have a thinning of our tissues. It's the connective tissues in our body. So it's not necessarily just at the pelvic floor, but it's at all of your tendons and ligaments as well. So a lot of times women will report even just shoulder pain or hip pain that has come about from exercising or anything in their daily routine. But for in the realm of pelvic health, um, that thinning of those tissues can result in a pelvic organ prolapse. This is when the vaginal wall is not strong enough to hold the pressures from the uterus, the bladder, or the rectum. So you have different types of a prolapse. You have the cystocele and the rectocele. So the pressure or the weakness of the vaginal wall may be coming from posterior pressure from the rectum, and that vaginal wall is weak, so it starts to envelope outward, or it can be coming from the anterior wall, which is from more of your bladder and your uterus. So, but it's not necessarily the organs coming out of the vagina. It is the vaginal wall enveloping outward because of the pressure. So, some symptoms that accompany prolapse is urinary incontinence or leakage. It can be either just coughing or sneezing and you leak a little bit. It can be the urge, or you have the urge to go to the bathroom and you can't quite make it in time. So either one of those. And then a lot of times patients will report a heaviness in their pelvic region or a dropping or a pressure. So that's another symptom that kind of accompanies that. And then lastly, painful sex because of it could be from the vaginal dryness, but it could also be because if that vaginal wall is enveloping outward, it could be touching your underwear and causing some chafing, just like I was talking about. And then when you go to have sex, the penis is rubbing on that area that's already irritated. So but yeah, those are the common symptoms that kind of accompany a prolapse. But I would say prolapse and vaginal dryness are the two biggest complaints that I have with pelvic PT and perimenopause and menopause. So
I really find that fascinating because some of those symptoms overlap with regular perimenopause symptoms, like the tightness, the joints, the hurting, the dryness. So women probably don't
yeah,
even think of the pelvic floor first because some women don't even realize they're in perimenopause either. They just think they're starting to fall apart and get old. And I am so thankful that you brought up the vaginal estrogen also, because for a long time we really didn't understand the benefits of that. And,
sure.
whether people choose to go on hormone therapy or not is personal, but we are, even on the podcast, we've had people on that have really talked about the research behind the benefits and the long-term benefits, but also that the vaginal estrogen is local. And I think that's really interesting too. And that works. But I love your coconut oil, your olive oil
Yeah,
suggestions too, because that's very nice and natural and you don't even have to buy anything else. Um,
exactly. It's in your kitchen
yes.
already.
I'm curious about emotionally, how are women when they come to get some help with this and talk to you about it, how are women feeling emotionally opening up about what's going on?
Oh my gosh. So I see a lot of women frustrated, first of all. I think they feel like something is wrong with them, and they feel like they you know, believe it or not, a lot of people come in thinking that pelvic floor physical therapy is not going to help them. But then after they have their first session with me and I educate them a little bit more on what's going on and what we can do to fix these things, they leave a little more hopeful. But I would say the biggest thing is frustration. But then, this is a problem too, in the sense that men aren't educated in this part of a woman's life. And for sexual intercourse, I have patients who don't tell their partners that it's uncomfortable. And that's a huge problem. We need to be more open with our spouses and our partners and letting them know how we feel instead of just letting them do their thing. And I guarantee you that if they knew what was going on, they would definitely be a little more cautious and, a little more conscientious of your needs too. So,
That's powerful. And it's interesting that you brought that up too, because I'm actually going to have a sex therapist on in the next month on the podcast to talk about that communication. So if you're listening to this, stay tuned because we are going to help you with that communication to communicate your needs to your partner, because most partners really just want to please you. They want to help. They want it to be a two-way street. So I think that's amazing. And you're having those conversations too with your clients, which is really helpful because it's way more than just the physical part of it. I
for
love
sure.
that. So just,
Um,
oh, go ahead. I'm sorry. I'm jumping in because I'm
that's okay.
so excited about this conversation. So go ahead. Mhm.
So I was going to say that a lot of times too, when people call me, they they want that personal environment because it's such a personal issue, and they ask me, or they tell me, hey, I have not talked to anybody about this except for my doctor, and I want to get a feel for what is going to happen, and what this is exactly. And um you know i I like the personal nature of my office. So we have one, or me and my colleague, we each have separate treatment rooms. And, we don't do this out in the open like a regular outpatient physical therapy gym. So we take you into a private room and we try to make, well, my husband, he's the engineer, right? And he tries to put up sound barriers so that way nobody can hear through the doors. Because they are, the walls are thin, and, this is a personal thing, and people want to feel comfortable talking about it. So it's a very personal experience, and yes, there you have the option of the vaginal exam, but you don't have to take it. But I always give the option of it. And for me, I like to do it because it's more it allows me to directly palpate the pelvic floor. But there are other things that you can do to help with pelvic floor strengthening. So
And we will definitely get into those. That is one thing that even though you were not in your private practice where you are now, which is a very special place because it's yours now, and you get to do
yeah,
what you want to do in that space. And one of the things that you are fostering is that privacy and that, making someone feel good and having that sound barrier. I think that's amazing. And even though we were in the other place when I was working with you, you were very good about explaining to me exactly every little step of the way. So there was no surprises. We did have that private room. And so I'm excited for you that you have your own space now that you were able to design the way you wanted. And that's
yeah,
great. This is a
yeah.
sidebar question because we know that incontinence comes with the pelvic floor issues, but I've also had women ask about pelvic floor and bowel movements and the feeling that they have, one in the same pain
Hmm.
and inflammation going on. So, can you talk about that a little bit?
Sure. So let me pull out my pelvic model actually, because this will be a good time to bring it into um, the picture to kind of explain some things. Well, okay, so I'm going to align the organs the way that they would in the camera. So
And for those of you who cannot see this, if you're listening to it on audio, like I said, I'm going to put some clips out on Instagram.
this is your bladder, your uterus, and your rectum. So if the rectum is full and you're having constipation issues and issues relieving your stool all the way, it can create pressure buildup through the bladder. And so when you have constipation, it's pressing on the bladder, and that's going to make you go to the bathroom more often. It can also lead to more incontinence if your pelvic floor is not strong enough to hold it back. So that's where bowel health comes into play. And then if you look, this is the bottom of the pelvic floor, or the bottom of your pelvis, I should say. So here is your vagina, but here is your rectum or your anus. So this is the pelvic floor. It's a bowl, and the the anus and the vagina and the urethra all have to puncture that muscle. So there's three holes that interrupt this muscle. And so if you look at it on the inside here, you can see the hole in the muscle. So it's like a bowl. And there's also different layers to the pelvic floor. So this is the superficial layer, the intermediate layer, and then the bowl or the levator ani is the deep layer. So yes, bowel health has a lot to do with pelvic floor urinary issues as well. So
Yes. And again, going back to perimenopause symptoms, when we drop in estrogen, that drop in estrogen can cause constipation. It's just
yes,
another symptom. So it's a perfect storm of things that are happening. So just paying attention to that and getting tested for hormones helps also, while also working on the pelvic floor, I would imagine, because we might be just missing some things. Again, hormone therapy is personal, but knowing where you stand might be, an understanding of the situation that's happening, especially with that bowel health. I love that you explained that. And for again, those of you who are listening and can't see, it was a great explanation, and I look forward to putting that out online. And I'm curious about men, even though we mostly are talking to women here, just so that women can think about this too. Do men have a pelvic floor also?
absolutely. Yep.
Okay. And
They can do Kegels just like you and I.
I did not know that men could do Kegels. That's
Yeah,
amazing.
and a lot of men don't know they can do them either. So it's interesting.
That's so cool. And I'm curious, how does sitting affect the pelvic floor?
So sitting is going to lengthen the pelvic floor more. But then you also have to think about your posture when you're sitting and whether the muscles are supporting enough to um, allow that pelvic floor to do its job. So if you're slouched and you're sitting like this, then, that's not a good thing. Your pelvic floor is not going to function the way that it should. But if you get your chest upright, you're engaging your abdominals a little more, then your pelvic floor is at an optimal length to produce the contraction to hold back urine.
That's great. So posture is another thing that I did not even think about with the pelvic floor. We're all connected. We should be thinking that way. Okay, so let's talk about what can people do? What can women do to strengthen their pelvic floor, whether it's working with someone like you or even on their own?
So overall strengthening, just going to the gym, lifting weights, doing cardio, all of that is very important for just overall strengthening. But there's two muscles in particular that share fascial connections with the pelvic floor. One of those is transverse abdominis, and the other one is gluteus maximus. So if you are doing exercises to focus on those two muscle groups, you are indirectly strengthening the pelvic floor. Another one that is used often is diaphragmatic breathing. So if you are using your diaphragm to inhale, then you are strengthening your pelvic floor as well. So I would say those are the three main muscle groups that you would focus on to treat the pelvic floor indirectly. To treat the pelvic floor directly, the Kegel is the way to go. But it's important to know that not everyone should be doing Kegels. There's certain pain conditions, pain disorders that actually advise you not to do them. And then if you have what we call a hypertonic pelvic floor, you're actually making it worse, and you'll end up making your symptoms worse if you have that. So Kegels are not always the answer, but just working those three muscle groups that I just talked about, the diaphragm, the transverse abdominis, and the gluteus maximus, you're going to get good results with pelvic floor strengthening.
Yes, I love that. And that's, some of those things are the things that we worked on. And also the diaphragmatic breathing, just really expanding in that rib cage as opposed to breathing through our chest. Is
Mhm.
really good for everything. I'm using
It
that
really
for
is.
all my clients, for stress, for
Yeah.
bringing it down, for getting present, all of it. So thank you for adding
Yeah.
that in there. And then the other
Yeah.
thing I wanted to share with everyone is Sarah taught me how to do a Kegel. Everybody thinks they know how to do a Kegel. They're like, oh, you're just,
Yeah.
acting like you're stopping going to the bathroom. But you really taught me like that I have to really pull up. So how would you explain that? I can't remember the wording you used, but I felt like elevator came into play
Hmm.
somehow.
Yeah, so there's several different expressions that I try because some people don't respond to one versus the other. So the most common one that I use is use the muscle that holds back your urine. If you feel that really strong urge to go, it's the muscle that's internal that you pull up. It should not be seen with the naked eye. So if you're doing one right now, I shouldn't be able to tell. Um, but that's the most common one. Use the muscle that you use to hold back your urine. The second one that I use is the elevator. So act as if you're taking the pelvic floor up each level. So you have your first level, your second level, and your third. I just did it as I was talking about
Me too.
it. And then the last one that I've used before is act as if you are trying to sip a smoothie through your vagina.
Oh, I love that. I love that.
It's funny. I've had people respond to that more than the hold back urine thing. So
Whatever works.
whatever works.
I love that. And that is true. That is actually how you taught me to do it because I definitely was not doing the levels and it took me a while before I could hold it for any length of time, but it was really great because I remember when we were doing work with incontinence, I would go to the bathroom just whenever I felt like it. And so I also had trained my bladder to not get very full before I had to go to the bathroom. And then I
Mhm.
also had to keep a record of it, which I thought was genius that you have women keep track of how long they go. And then when they go, how long is the stream? How many seconds is that taking? And I still to this day think about that because so
Oh
if
yeah.
someone is having normal urinary health, how long should they be able to go between going to the bathroom? Assuming you're not sucking down a gallon of water, in one sitting, what would be kind of normal or a range that would give women an idea of maybe they should check into this?
Every 3 to 4 hours.
I'm
And
still not up to that.
yeah. So I always say, if I had a patient yesterday who said she goes 2 to 3 times every hour. And so you start small and you work your way up. So what I told that patient yesterday was, okay, let's try to focus on just going once every hour. And this is getting into bladder retraining, which also strengthens the pelvic floor. So let me get into that a little bit. I,
I
I don't
love
need my
it. We
pelvic
need to
floor.
go here. It's all connected.
It is. Okay, so when your bladder is supposed to be 2/3 full before your brain will register that it's full and you need to go to the bathroom. So if you are going every 2 to 3 hours, then your bladder is not filling up to that 2/3 full. So how long it typically takes is 3 to 4 hours for your bladder to fill to that 2/3 mark. The problem is that it's a feedback loop. So if you're going every hour, your brain starts to register that your bladder is full when it's really only a third full. So if you come into that routine, then your brain will start to register that your bladder's full when it's really not. And then you're going to have to go to the bathroom more often. So I teach my patients to gradually increase that voiding interval. So we start with 1 hour if, they were like my patient that did 2 to 3. And then once they feel like they've mastered that for a couple of weeks, we bump it up to every hour and a half. And you have to think that one of the functions of the pelvic floor is to support your internal organs. And water is weight, and your bladder is holding a weight, and your pelvic floor has to be able to support that. So, naturally, as you're retraining your bladder to hold urine, the bladder's 2/3 full, that's naturally strengthening your pelvic floor if you think about it, because that's a weight that's being placed on your pelvic floor. So this is another way that you can strengthen your pelvic floor without doing Kegels.
I love that. It's weight training for the pelvic floor. And it's great because you definitely taught me to quit doing the just in case pee. And I literally would do that. I would be like, oh my gosh, I'm going into a session with a client. I better go. And I probably could have made it all the way through the hour. And the other thing that I did was, years and years of running the having like just going to the bathroom any chance I had with a bathroom because I didn't know how long I'd be out there. And it just created, this habit. It was literally just a habit. And I find now I'm always, impressed with myself. I actually like pat myself on the back when I really have to go Here's a great example because we go to the same church. I'm sitting in church and I get in late, so I don't want to go all the way to the bathroom and miss something. And I'm sitting there and I'm thinking, can I make it all the way through? And then when I'm done, getting distracted, going out the door and saying hi to everybody and driving home. So I didn't go even right after the service. I drove home, did a couple things, and that's how I know that I'm getting better at it is because I actually am going longer and longer. So do have to say
There you
thank you
go.
for that. Yes. And I'm curious. Yeah, all the things that I got out of this. So I'm curious too. When is it ever too late to start working on the pelvic floor? Because I have some women who come in their 70s. And they're like, well, I'm just too old. I'll deal with it. Is that too late or can they even start then?
That is one of the biggest myths ever, and it really gets me on my high horse. um, no, it is not too late to start. And it is true that we start to lose muscle mass throughout our whole bodies after the age of 25. It's a gradual decline. But the thing is that if you lift weights and you really try to strengthen up all of your muscles in your body, not just the pelvic floor, then you are decreasing that decline. So it's never too late to start. And yeah, so I've treated people that have been in their 70s and 80s and they respond just as quickly as anyone else that I've trained for the pelvic floor. So no, it's not too late.
Oh, that's great. And thank you for
Yeah.
mentioning building muscle and the importance. We are really understanding now how important building muscle is and keeping muscle as we age, because not only is it, helping to support all these different areas, including the pelvic floor, but it's an endocrine organ and it really is helping us with everything, including, blood sugar processing and our hormones, helping to help stabilize that a little bit. And, so that's great. It all ties together. So,
Yep.
Sarah, I'm so thankful that you were here today. Is there anything else that you would like to add? Because you gave us some great tips, but if there's anything else you can think of, please share.
Yeah. Yeah. So I would say if you're going through perimenopause or menopause, I'd say the top three things is to try to exercise daily for at least 30 minutes, include weightlifting and cardio in that, because like we talked about earlier, it's strengthening your pelvic floor indirectly to exercise. But then you're also helping all the other um, parts of your body too, because like I said, tendons and ligaments, they thin as well. And so if you get your muscles nice and strong, it'll help provide more stability to your joints. So that way you don't have the increased risk of having a tendon tear or, all of those things. The second thing I would say, we didn't really dive into this too much today, but when you are lifting something heavy, you want to manage the pressure that is in your abdominal cavity. Because if you're holding your breath while you're lifting something heavy, or if you are constipated and you're trying to have a bowel movement and you're holding your breath while you're pushing, that is definitely going to increase your risk for prolapse because that pressure has to go somewhere and it's going to follow gravity and your pelvic floor is at the bottom of that. So if you're holding your breath and pushing, the pressure is coming more through your pelvic floor, and that's going to lead to a prolapse. So the way to manage that pressure is to exhale on exertion. So you want to try to use pursed lip breathing. So you would exhale just like this. A small O and breathing out through the mouth. Um, and then the third thing I would say is try to manage your constipation so that way you don't have to strain when you go to the bathroom. That, like we were just talking about with the pressure management system, that's the proper way to poop is to breathe out through your mouth with pursed lip breathing. So that way the pressure is escaping the body and not being pushed down through the pelvic floor. So. Those are my top 3 tips.
Those are amazing. Exercise, managing that heavy pressure and managing how we are, with the constipation, but really the breath work. Who knew we were going to learn how to breathe through pooping? That's amazing. I love it. This has been such an amazing and informative talk. Thank you, Sarah, for being here. I want to share you with everyone. So please tell everyone where we can find you.
Yeah, so my website is www.thecoreconnectionpt.com. I also have an Instagram at core.connection.pt.
I love it. And if you are local to St. Augustine and listening, please make sure you head over to her sites and also just listen in to her Instagram also. Sarah has a lot of the things that we talked about. It's broken up into little snippets, and she's also got her little models out there. It's amazing. And you get to see those beautiful kids that you have. And again, Sarah, I appreciate it because as women, it's hard for us sometimes to have these really open and honest conversations about those parts of our bodies. So thank you so much for being here today.
Yeah, thank you for having me, Kim. Always a pleasure.
And for everyone else out there, nourish your entire life and give yourself grace today. That's it. Thank you so much for tuning into the Emotional Eats podcast, the podcast that's here to help you feel amazing, strong, energetic, and healthy holistically in your mind and your body. But my guest and I also want to help you build great habits to help you with long-term mental and physical health so that you can lean into aging in a very positive and strong way. Check out my website, kimhines.com, and please come see me on Instagram at kimhineshealth. That's where I leave tips for healthy life, healthy body, healthy relationship with food, and I also am there to encourage you, and I love to hear from you. So tag me and let me know what you like about the show and what you want to hear more about. Check out the show notes for all the details. Make sure to rate and review the podcast. And until our next time together, nourish your entire life and give yourself grace today.